Hello and welcome. Today's presentation will address the question, how can medications impact on wound healing? Before we can successfully answer that question, we must firstly understand the mechanism of wound healing and the type of medications currently used for wound management. Throughout the presentation, background information regarding both acute and chronic wound healing, followed by an explanation of the varied medications used in both situations, will help identify the impact of medication intervention therapy. By the end of this presentation, the answer to the questions surrounding medications and wound healing will not only become apparent, but will also be explained along with the supporting evidence obtained. Wound healing takes place in all tissues and organs of the body. The process of healing is continuous and is divided into 4 time-dependent phases. Phase 1, the acute inflammatory phase, occurs immediately after injury. The coagulation cascade is activated through extrinsic and intrinsic pathways. Blood changes from a liquid to a gel to prevent excessive blood loss from occurring. The destructive phase begins shortly after the initial phase and consists of 2 subcategories. The aim of this phase is to establish an immune barrier against invading microorganisms. The complement cascade is activated, which initiates molecular events. This leads to neutrophils invading the wound to prevent infection. Stage 3, the proliferative phase, which starts within days of the injury and encompasses the major healing processes. Once injury has ceased and homeostasis has been achieved, with an immune response activated, then the wound shifts to tissue repair. And finally, the maturation phase, in which scar tissue formation takes place and may last up to 1 or 2 years. This remodeling phase is responsible for the development of new epitheliums and scar tissue formation. The collagen collection encourages the tensile strength of the wound to increase progressively and in parallel. Collagen fibers may regain approximately 80% of the original strength compared to that of unwounded tissue. The original strength of the tissue can never be as previous to the injury.
The treatment of wounds require drug therapy at times, but must be monitored as they have effects on different components of the epidermis and its underlying structures, along with specific wound healing phases. Antiseptics such as iodine-based preparations and silver-releasing agents. Main mechanism of action is non-selective, but mainly damages the cell wall and cell membrane of pathogens. It can also inhibit bacterial cell respiration and deactivate intracellular enzyme organelles. However, its effect mainly occurs at the surface of the wound. Zinc are practical in treatment as they are required for epithelial and fibroblastic proliferation, but must be monitored as it can delay wound healing due to its impact on macrophages. Antibiotics should be monitored as prolonged use can lead to the development of superinfection or antibiotic resistance. Antibiotics are specific to the type of bacteria it destroys. It should only be used when there is an active sign of infection. Topical antibiotics that contain ingredients such as neomycin, polymyxin, and neosporin have proven to enhance reepithelialization to the wounds. Drugs that have anti-inflammatory properties caused by infection through the inhibition of leukocytes are both tetracycline and erythromycin. A study conducted by O'Meara, O'Carty, Ogun, and Overton explored the effectiveness of systemic and topical antibiotics on wound healing among 22 trials. From the study, results showed topical antibiotics generated a greater healing rate than standard care and systemic with a placebo.
Indications for the use of medications for wound management. For topical antibiotics, they are most effective when applied within 3 hours after wounding. However, if the wound is completely debrided, thus creating a new wound, they can be applied within 3 hours of debridement and are considered effective. Examples of these are triple antibiotic ointment and nitrofurazone ointment. Both of these have a wide antimicrobial spectrum. Gentamicin sulfate has a narrow antimicrobial spectrum, but it may be applied to wounds infected with gram-negative bacteria. Corticosteroids. They act as a granulation tissue suppressing agent. This is used in the initial stages of a wound formation as it suppresses the granulation formation in the wound, which therefore promotes epithelialization and contracture of the wound. Enzymes for wound debridement. Enzymes such as trypsin and elase are commonly used for pressure ulcers, burn wounds and venous ulcers. They debride granulation and necrotic tissue in wounds. Antibiotics. Oral antibiotics such as cefalexin, amoxicillin, flucloxacillin and dicloxacillin can be used for several purposes such as post-op surgical wounds, deep soft tissue infections and ulcer infections. There are some considerations which must be taken when considering the use of medications for wound management. Factors such as allergies, renal or hepatic dysfunction, or drug interactions should be taken into consideration, and a thorough medical history should be taken to avoid consequences such as anaphylaxis and renal failure. Consideration for the type of drugs used, along with the type of wound and its severity, must be taken in and evaluated to ensure the most appropriate treatment is given.
Antiseptics can be considered a contraindication for wound healing because they're non-selective dilute disinfectant and their agents function as non-specific broad-spectrum microbial inhibitors without a specific target, thus being toxic to host tissues. They function by damaging the cell wall or cell membrane of the pathogen, causing changes in the permeability. Antiseptics are toxic to some bacteria, spores, fungi, and viruses. They reduce the bacterial number in the wounds, which may cause a possible infection and/or impair wound healing. Vasoconstrictors include epinephrine, nicotine, and cocaine, and are contraindicated to wound healing because they may cause tissue hypoxia in wound healing as it affects the microcirculation and tissue formation. Subcutaneous wound tissue oxygen is reported to be significantly reduced and remain low after consuming a vasoconstrictor, causing a lack of nutrients and blood reaching the lower limb, which may hinder wound healing and ultimately lead to ulcer necrosis. Steroids are a contraindication to wound healing because it inhibits epithelial proliferation and exerts anti-inflammatory effects. The inflammatory stage is a stage where maximum disruption to the healing cascade occurs, slowing down healing. The normal process of neutrophils and macrophages into the wound bed is prevented, making the wound vulnerable to the infections and delay of wound healing. Anticoagulants. Warfarin inhibits hepatic synthesis of vitamin K factors, which is responsible for the normal clotting of blood. This is a contraindication for the wound healing as it slows down the healing process. Heparin, along with cofactor antithrombin, inactivates thrombin and other factors which inhibit fibrogen conversion into fibrin. It has been speculated that both these medications delay wound healing due to the lack of fibrin formation. Both anticoagulants and antiplatelets are medications that enhance hemata formation. Hemata is an excellent medium for organism growth along with disrupting tissue structures. They create a hypoxic environment for the surrounding tissues, delaying good wound healing. NSAIDs are a contraindication to wound healing because they inhibit both cyclooxygenase and lipooxygenase transformations of arachidonic acid, having more of an anti-inflammatory effect as opposed to an antiplatelet effect. Davidi et al. Examined the effects of ibuprofen and diclofenac on wound healing, and both drugs showed hindered tissue repairment due to delayed inflammation. Another study by Krishak et al. Was done to examine the influence of diclofenac on wound healing with rats and showed a massive reduction in fibroblasts, thus impairing wound healing.
Specific for each wound type. Ischemic wounds occur as a direct result of blocked blood flow to vascular beds within the body, creating arterial insufficiency. Silostazole is a cyclic AMP inhibitor that increases the microvascular circulation in severely ischemic limbs. In a study conducted by Arakawa and Arata, it was found that silostazole decreased the amount of pain, numbness, and erythema in patients with poorly healing skin ulcers. The study states the introduction of silostazole as a part of treatment plan could be beneficial for the treatment of skin ulcers associated with vascular disorders. A pressure ulcer is formed on an area of skin where there is increased friction, shear forces, or pressure resulting in tissue breakdown. These occur frequently in patients that are immobile due to illness. As pressure wounds entail a more mechanical etiology, the use of medication as part of the treatment is not indicated, the exception being pain management. However, a study that used the topical ointment of Elase can be used to promote debridement of necrotic and purulent debris from skin ulcers. Neuropathic ulcers are wounds that occur primarily due to the loss of protective sensation in the feet and legs, rendering the patient unable to feel, for example, pain or vibration. This can be a result of a primary neurological condition, example diabetes, or due to trauma or surgery. Biocapolamin is a topical gel that is prescribed as part of a total treatment program to help heal ulcers of the foot and lower limb in diabetes patients. It is a recombinant platelet-derived growth factor that is sometimes prescribed to improve healing times.
Venous ulcers are wounds that occur with sustained venous hypertension as a result from chronic venous insufficiency. Some research suggests that for venous ulcers, topical antiseptics should be avoided. This is due to increased risk of bacterial resistance and contact dermatitis. However, in the systematic review by O'Meara et al., it was concluded that there is improved wound healing with the use of systematic or topical antibiotics. Pain management is also an essential part of wound management. NSAIDs are somewhat contraindicated as it may reduce pain but delays healing time due to the hindering of the inflammation process. Mild opiates and anticonvulsant medications are indicated as a good pain management option for most patients. The treatment options for wounds should contain a comprehensive total treatment plan that should include a variety of factors such as nutritional status maintenance, debridement, prevention and management of infection, an optimal moist wound environment, and adequate pressure relief.
Search strategies used to locate the article included typing impact of medication on wound healing into PubMed and retrieved 96 journal articles, but it was not relevant to nor specific to the question. So it was changed to antibiotics and antiseptics on wound healing and retrieved 60, then further changed to antibiotics and antiseptics on leg ulceration and retrieved 8 articles. The article I chose explored the effects of systemic antibiotics, topical antibiotics, and antiseptic on healing on venous ulcer. I then compared the article with Petri scale and it scored 9 and 11. It is a randomized controlled trial, which is the highest level of evidence of a hierarchy. The result concluded there was an increase in wound healing among participants who took systemic antibiotics and topical antibiotics. However, the study was small and results could be due to imbalances of prognostic factors, but due to the lack of systematic evidence provided, both forms of antibiotics can still be used.
Hey, hiya! So, after considering the explored evidence, it is clear that the medication must be monitored as there can be both positive and negative impact on wound healing. It has been investigated and shown that medication has the potential to delay healing. However, research has advised that the implementation of medication is better than taking no action. Although there are many variables to each phase of wound healing, there is substantial evidence that suggests that medication can increase wound healing compared to standard care. Alright mate, something else. Factors such as dosage, mode of administration, time of application should be carefully considered and individualized as well for each case to avoid unnecessary contraindications. Alright, something else. Additionally, it is strongly recommended that medication should be used in conjunction with the holistic approach rather than by themselves. Thanks.